Well, thank you for taking a look at the BPH pathway application. Our goals in creating the app were to provide an application that improved patient symptoms efficiently, provided quality care that can be customized to each patient, maintain evidence-based practice, and we put a real focus on education, and you'll see that in the app. We want to be able to follow patient outcomes in real time. So in order to do this, we basically created an in-depth app that as soon as a patient leaves the office, they can access and have a repository of information. It's very easy to follow. Content can be updated at any time. They're reached out to frequently, 2 to 3 times per week, and it allows you to communicate with the patient and view their progress in real time. To get started, you type in the patient's name, then you can enter a cell phone number if they want to use the app on their cell phone, or use email if they'd rather use their computer. After the patient creates a username and password, they go to this home page, which is where they start the pathway. This row shows an overview of the pathway. It starts off with education, then moves on to step 1, lifestyle changes, which may include decreasing dietary irritants, avoiding on a time basis, and limiting fluid after 6 p.m. If no significant improvement, it moves on to a 1-month trial of medication. If still not satisfied, the patient comes back for an office visit, consideration of testing, potential trial of another medication, or procedures. This last header shows check-ins, and the application checks on the patient every week during the pathway, and then when they're completed with the pathway, it checks on them every 3 months to see how they're doing for the first year. So after the patient starts the application, it's going to basically ask for permission to follow their progress as the first step. Then it's going to set up a series of questions and slides that goes over the background behind the application, education on BPH, and it's going to take them through an IPSS questionnaire. On the right, you can see a calendar, and this basically shows where the application is reaching out to the patient. The circles indicate messages or tips going to the patient, basically 2 to 3 times per week. You can see a check box there. That's where we answered the first question. So all of these other questions come as the patient goes back and starts up again. But this is an overview, and patient can check into this and take a look, see what Flomax is. This leads them to another page that has information on the medication, why it works, what are the side effects. Then can go back to the pathway and look further on the various steps. Step 3 includes testing, so they can take a look and see what is cystoscopy. And if they get to step 4, they can take a look at some procedures that are available. In this example, looking at UroLift, we have another list that goes over benefits to the procedure, risks, what it entails, and has access to the website for the patient if they want further information. At any point, you can use the dashboard feature of the application, which is a basic overview of all the patients who are enrolled in the pathway. You can look at individual patients and see what step they are on in the pathway. You can sort for who needs follow-up, what are their IPSS scores, who's ready to come back for treatment. This can be customized for any factors you want to look at. In this fictitious patient, there's one notification that they're ready for a prescription renewal. And you can see here, these are all of their answers throughout the pathway, and shows again where they are and what steps they've gone through. So that was just a brief overview of the app. Why do you need it? Well, I love it because I know that I'm providing excellent care for my patients. I know the content that I'm giving them, and I know what their outcomes are. You can't possibly cover everything in a single office visit from A to Z for BPH. And even if you're using a nurse navigator, it's impossible for them to do it over the phone as well. So it really augments and saves everybody time. Reaching out to the patients, getting them involved is increasing patient compliance. Helps with your practice. Patient calls in and wants to go to the next step, they can be easily put in for a cystoscopy or whatever is appropriate. And you're again able to watch them real time on how they're doing and follow them long term. These kind of things unify your practice. Everybody's practicing in a similar fashion with BPH. Everybody's on the same page. Why do patients like it? Well, they get better quicker. So it works. Close monitoring is done. So patient has a problem, they can send a message. They don't like the medication, they want to get in for the next step. It's really easy. Everybody knows where to put them. Also saves the patient unnecessary visits. If they're doing fine, they don't need to come back. Saves them co-pays and helps open up new slots for you if you wanted to see new patients. Patient has this repository of educational material to look at any time, and it also checks on them long after the application is done, up to 1 year. As an overview, app usage empowers patients and facilitates patient communication with their providers. The more educated a patient is on their condition, the more engaged they are, and the better their outcomes. Your practice needs a digital engagement strategy. So does my practice. That's why we're working on this now. Early adapters are going to be able to change the way we deliver urologic care. Now is the time to get involved. This app integrates mobile technology with clinical care. It documents how the patient is interacting and their outcomes. That is how we're going to show we're providing quality care for these patients. Don't forget, in the age of information, big data is king. Thank you very much.